Good afternoon, Lisa Homa here. Hope you're all having a great day. Today we're going to be discussing the essential elements for healthy partnerships. The objectives of this lecture are to discuss the nurse's role in population health. On to Chapter 1. Before we dig into the deeper concepts in this unit or in this weekly module, we're going to go over a few concepts of global health. Did you know that nurses constitute 50% of the global health workforce? And I mean all healthcare workers throughout the entire world, 50% of them are nurses. Of the 43.5 million healthcare workers, 20.7 million are nurses and midwives. In the rural areas in Africa, 85% of the healthcare is provided 100% by nurses. Nurses must have awareness of key global health issues and the roles that they play in addressing those challenges. So what is global health? It's an area for practice, study, and research that places a priority on improving health, achieving equity and health for all people, and ensuring health-promoting and sustainable socio-cultural, political, and ecosystem health. It emphasizes transnational health issues. Let me just define transnational. It is a threat that does not respect national boundaries, and it's usually committed the event occurs as a result of someone who is not a citizen. So this would be like a terrorist, for example. They're not U.S. citizens, they come onto our soil, and they create this event. And how does this apply to population health overall? So it becomes a threat, for example, like this crazy thing that we've been going through for 2 years called a pandemic. Remember when Ebola came in a few years ago? It could be a biological agent or biological warfare, something of that nature. So it emphasizes transnational health issues, determinants and solutions, involves many disciplines, all right? We're at the forefront, but we need a lot of help. We're the great collaborators among many disciplines. And we promote interdependence and interdisciplinary collaboration. And this is all a synthesis of population-based prevention and individual holistic care. Additional concepts. A little background on the slide is there's a growing recognition of the importance of preparing nurses and other healthcare disciplines with global health competencies so they can make maximum contributions to promoting health equity and health for all. So these 4 bullets that you see on the slide are a culmination of a lot of research. So it's Wilson et al. They collected data from more than 800 nursing faculty in over 6 continents to identify global health competencies for nurses. From this, 4 different competency levels were born, starting with the global citizen level proposed for all university students. So this is where you come in, you fit right into this. The use of evidence-based nursing process. So we want to use a systematic process in research, and we know as nurses, the one that works best for us is the nursing process to promote sustainable planetary health and equity for all. You're going to see this concept over and over and over again in this course. Global health considers social determinants of health, and we're going to talk about that a little bit later, which includes individuals and population-level care, research, education, leadership, advocacy, and policy initiatives. Global nurses engage in ethnic practice and demonstrate respect for human dignity, human rights, and cultural diversity. Global nurses engage in the spirit of deliberation and reflection in interdependent partnership with communities and other healthcare providers. Now we're going to talk a little bit about globalization. And it refers to the increasing economic, political, social, and technologic and intellectual interconnectedness of the world. The best way I can describe this is to think about a systems theory. Let's put the patient in the middle of a system. The patient is influenced by the person who comes in to empty their trash if they're in the hospital, the person that delivers their lunch to them, the nurse who takes care of them, the physicians who take care of them, right? They're influenced by a lot of different things, their support system. And globalization is influenced by an awful lot of things. Let me talk about a couple of the influences to globalization. Changes in the world economy in one part of the world can impact the markets in other countries. Think about how COVID spread, right? It came from other parts of the world and then it came into the US. Very much similar process. Emerging infectious diseases can spread quickly across the globe. And we learned in the history of nursing in global trends something very similar. That's how the bubonic plague was spread when they were talking about Christianity to people all over the world, they brought their bugs with them, and this is really no different. There are some great things. There are positive and negatives about globalization. One of the negatives that we see from a population health perspective is the spread of infectious disease. Other thing to mention is global trade policies and deregulation. And let me say how this influences health. So let me give you an example. A couple of years ago, there was dog food that was produced in China, and it came to the US, and a lot of dogs were dying here. And let's talk about policy and how important that is. So in China, they're allowed to add melamine, which is a food additive, to dog food. And it's not against the law. It doesn't break any policies. But here in the US, we banned it because of its carcinogenic effects. Just an example of our pet population. Globalization is not a new phenomenon. This has been happening since the inception of time, right? There are discussions of globalization actually in the Bible. The current phase is different from earlier phases because of the speed of the new technologies, a change in resources, people, and the sharing of information, which is just making this go so much faster. The relationship between globalization and health, and we just talked about it, right? So this whole dispute politically, and I'm not here to talk about politics at all, but just to give you an idea. So the openness of our borders can impact our health, our policy of health, right? If we have people coming in from other countries, let's say their vaccination programs are different, or let's say they don't have one at all. I don't believe Mexico has a vaccination program at all, and we cannot count on a consistent level of health of the citizens who come over into the United States. So the openness of the border is a huge health concern for us, right? What if those people are coming over bringing COVID? What if they're not? I am not judgmental in any way, shape, or form. Just saying that national policies and all these things impact our borders, and it all has an eventual outcome on our population health. We're going to talk about the CDC's top 10 global health issues. So starting with global health security. It's an international effort operating in the field of infection prevention and control. It was launched in February 2014 by a group of 44 countries and organizations, including the World Health Organization. Global health protection is about more than one country, one issue, and one pathogen. Many factors affect our health security, like infectious disease, humanitarian crises, and growing burden of non-communicable diseases. Moving over to the third is immunization. The CDC's Global Immunization Division is involved in one of the most effective of all global public health missions, which is vaccination against deadly diseases. It works very closely with partners in 60 different countries to vaccinate children against contagious and potentially serious diseases. Now we talk about travelers' health. We've heard a lot about this with COVID also. It works to safeguard the health of the U.S. residents traveling internationally or living abroad. Travelers' health focuses on the following activities. It conducts global disease surveillance and response, researches illness and injury in travelers and U.S. citizens living abroad. Next is HIV and tuberculosis. They are the world's two most deadly infectious diseases. Additionally, these two epidemics are tragically interconnected, as TB is one of the leading causes of death for those living with HIV. 32 million people have died from HIV, and we still don't have a vaccine for the deadly disease. The next is malaria and parasitic disease. 409,000 deaths from malaria worldwide, 850,000 deaths from parasitic infection. And I just have to share something interesting. I had one of my grad students at Penn spent time as a nurse. She traveled and lived in Malawi, Africa. She lived there for 2 years. And she said in the village where she worked, she was the primary caregiver to the village people there. And they didn't have any cancer of any kind. What they had and what people died from were parasitic infections. Just wanted to share. And the last one is food and water. Food and water insecurity is a serious threat. 3 million people die from hunger. 829,000 people die from lack of water or from contaminated water sources and from the diseases that are caused by drinking contaminated water. Millennium Development Goal, I'm mentioning it because the textbook has mentioned it, but it's been replaced by the next slide. So we're going to kind of skip right through it, and I'm going to go to the Sustainable Development Goals. And I'll explain what that is. These are goals that have been established by the United Nations. The 2030 Agenda for Sustainable Development urges care to an action by all countries that are both developed and in a developing state. And these are their top 17 goals. The first is no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth. 9, industry, innovation, and infrastructure. 10 is reduced inequalities. 11, sustainable cities and communities. 12, responsible consumption and production. 13 is climate action. 14 is life below water. So that's protecting the animals in the sea. 15 is life on land. 16, peace, justice, and strong institutions. And 17 is partnership for goals. The implications of health diplomacy for nurses. So let's first define what it is. It combines the art of diplomacy with the science of public health. It's an emerging field that addresses the dual goals of improving global health and bettering international relations, particularly in conflict areas and in resource-poor environments. It balances concrete national interests with an abstract collective concern of the larger international community's health. It reduces health inequities. It secures human rights and recognizes that effective international health interventions are ethical and sensitive to historical, political, social, economic, and cultural differences. Let's talk about the nurse's role in universal health coverage. So nurses are at the forefront of this, and because of what I mentioned, I think in the first slide, there are 35 million nurses worldwide. The role of the nurse in universal health coverage is investing in nurses will improve services overall for health promotion and disease prevention, because we do all the heavy lifting, right? Nurses, we have the ability to influence and change patient behaviors that cause communicable diseases. It's really important. We can also improve access to healthcare services and improve overall health outcomes of our patients. On to Chapter 2. The textbook talks specifically about the 10 great public health achievements in the 20th century. The first is immunizations. Second, improvement in motor vehicle safety, workplace safety, and we mean that from an OSHA standpoint, like wearing earplugs to protect your hearing and things like that. Control of infectious diseases, decline in death from heart disease and stroke, safer and healthier foods, healthier mothers and babies, family planning, fluoridization of drinking water, and tobacco, reducing tobacco as a health hazard. So in the past, in politics, there was a focus on disease, clinical care for disease control. So the person already had the disease, but there was absolutely no discussions at all about prevention. So here's where the shift is, where we are in the 21st century. We're shifting towards prevention and control. We also are working on mechanisms to deliver and pay for illness care, continue to drive the current healthcare system. So we talked a lot about that in safety strategies. We can no longer afford the type of healthcare we're delivering. There's almost no focus on prevention. We are getting a little bit better on preventing disease, but a lot of those resources or supportive resources aren't available or not covered by insurance for our patients. So that's important to build those things into our health policy. And the other main point of this is that there are a lot of experts that have debated these issues. They haven't come to a consensus of what should be done, and they wonder about how can we make our population in general healthier, and how can we best pay for their illness. So again, there has to be cost effectiveness to the care that we're providing as well. So the next is the 10 essential public health services. So of course we have equity in the middle. If you're looking at how we start to make these changes in public health, and it all starts with assess and monitoring a population, which you are going to be doing this week. You're going to begin that process. The steps of that process in next week's lecture. Going to investigate, diagnose, and address health hazards and the root cause of those health hazards. Communicate effectively to inform and educate the population. To strengthen, support, and mobilize community partnerships. To create, champion, implement policies, plans, and laws to help overcome those challenges, to utilize legal and regulatory actions to make sure that those policies are implemented, then enable equitable access, build a diverse and skilled workforce, improve and innovate through evaluation, research, and quality improvement, and overall build and maintain a strong organizational infrastructure. So in community health nursing, the focus, it's a combination of nursing and public health applied to promoting and preserving the health of populations. Again, I feel like this is just repeated so many times in our chapter readings this week. We need to treat the population as a whole, But yet, we still have to focus on individual family groups and the community. It's like the systematic influence of how all those pieces are interrelated within a community. Utilizing health promotion, health maintenance, health education, and management coordination, and the continuity of care for meeting population needs. Here's the 10 ways public health nurses improve health. We already talked about this in the other slide, but this kind of just says it really nicely. The first is to prevent, and we do that by educating, coordinating, protecting, leading, promoting, advocating, providing optimal care, and then integrating that within the community and providing more research to make sure that we've done a great job and that we continue to inform practice and make sure that we are focusing on improving the health of the individual, family, and community. On to chapter 3. So we're going to talk about epidemiologic measures of community health, but very simply, we are going to do a deep dive into epidemiology in the coming weeks. But just to start introducing this topic to you, epidemiology and demographics or demography are just tools that scientists use for studying population health. The use of epidemiology approaches can significantly enhance community health practice, provide both a body of knowledge and methodology for investigating health problems and evaluating health services. Some of the key terms so that you can become a little bit more familiar. These should become second nature to you as we dive into the epidemiology units later on. The first is just to explain what the heck is epidemiology. It's just concerned with the distribution and determinants of health and disease. It also includes morbidity, injury, disability, and mortality in populations. Populations in this context refer to people with a common characteristic such as their gender, age, place of residence. The definition of descriptive epidemiology focuses on the distribution of frequencies and patterns of health events with groups in a population. Analytic epidemiology just seeks to identify associations between a particular disease or health problem and its etiology. And the last one is demography. It's a statistical study of human populations with reference to size, density, distribution of vital statistics. Demographic statistics provide information about significant characteristics of a population that influence community needs and the delivery of healthcare services. We've also seen primary, secondary, and tertiary prevention in other courses. This is just a repeat theme, and it's applied here to population health. So we're going to talk about this just really briefly. Primary prevention, its goal is to decrease vulnerability and reduce risk factors, prevent disease and dysfunction. So primary prevention is all about prevention, right? Secondary prevention is the person already has started with the disease process, but we want to attack that disease early in the process and make sure that it doesn't become debilitating. We want to decrease the severity of that. And some way that we can intervene here would be screenings, right? We want to, if you get a mammogram for breast cancer, things like that. Tertiary prevention is person's already been ravaged by the disease, and now we're working on recovery and restoration from that disease. Descriptive measures of health. So these were mentioned in the chapter, and I just wanted to talk about them because I feel like they're used interchangeably, and they're really not. They're totally different terms. Morbidity refers to someone being unhealthy. Mortality, on the other hand, refers to someone being dead. So the mortality, so let me give you an example of mortality is, if someone has or in septic shock, their mortality is 50%. They have 50% chance of dying from sepsis or septic shock. Morbidity is like a risk factor that places somebody at a higher risk of something terrible happening to them. Like descriptive measures of health, an incidence is any health or disease condition that a number of people in a population develop the condition during a specified period of time. The prevalence is the total number of people in the population who have the condition at a particular time. Some other key terms to understand epidemiological outcomes. So a ratio is just a relationship between two numbers. Like, for example, how many males are impacted by this disease and how many females. A proportion is a ratio where the numerator is included in the denominators. How many males total were born? The rate is a proportion with this specified period of time. So how many deaths occurred in 1999? And let's talk about relative risk. Determining whether a relationship or association exists between a health condition and a suspected factor. The best way that I can describe this comes from my background, is to talk about a risk of stroke in African Americans. In 100,000 people in the Caucasian population, 5.1% will die from an ischemic stroke event. Compare that to the African American population, where per 100,000 people, 16.9% of African Americans pass from an ischemic stroke event. So the relative risk is clearly different, and it is increased depending on your race. Let's talk about internal and external risk factors. Premature death. A person is considered premature death if they pass before age 45. Odds ratio. So the odds ratio is just a mathematical ratio that talks about the odds of having a specified health condition when either factors are present or factors not present. Attributable risk is just the measure of the difference between the incidence rates for those exposed and those not exposed to the risk factor. And then criteria for determining causation, it's whether the association is strong, if it's weak, if it's specific. It is not the result of the confounding variables. Sources of community health data. As you begin to assess your population, these are some health records you'll be able to collect on your population. So the census is a great one. Vital statistics, I have the link here, but of course you can see this on the course. This will help you to get more data on your selected population. Notifiable disease reports, these things are all located on the web. The vital record linkage, medical and hospital records, now of course that's specific and that's private, autopsy records, National Electronic Disease Surveillance System, and screenings for health conditions. So screening for health conditions, there are 3 parts to screening. Presumptive identification of an unrecognized disease or defect by the administration of a test, exam, or a procedure that can be done rapidly. And then the third part is anyone who shows evidence of symptoms of a disease would have further diagnostics. Chapter 4, Ecologic Mechanisms that affect human health. The first would be increasing populations and growing economies as a result of high total consumption. Developed countries are high consumers. We are kind of frivolous. We grow up not appreciating that we have clean water and sanitation. And so that's just something that I think we take for granted. Fresh water is a huge impact on public health. So when we're high consumers, it places additional pressures on the ecosystem that directly increases certain health risks. Also, we see, let's say, for example, in developed countries, especially in the United States, we see a lot of obesity. It's all part of the high consumption, overnutrition, and physical inactivity, and then you add pollution. So now those become our health risks. The other part of this is nutrient and waste management, processing and detoxification of the ecosystem. We want to make sure that we are using clean, workable soil to produce food. If we are constantly polluting our soil, then that's going to cause health problems down the road on one of the steps of the process. And then, of course, regulation of infectious disease is a critical part of managing our ecologic mechanisms. These are the key terms in ecologics. So when we're talking mainly about pollutants, so there are 5 pollutant mechanisms. The first one is transport. It's where we transport a pollutant once introduced into the environment is generally accomplished by way of wind. So it's something blowing to another part of the geographic region. It comes through water, so through the aquatic systems, or it's aerosolized in a gaseous state, and then it goes up into the clouds and comes down into another geographic location by rainwater. Transformation is a harmful substance is rendered innocuous or even helpful during a biodegradation process. This is gamma and beta radiation, for example. A bioaccumulation is the introduction of substances into ecological food webs. So that's chemicals that behave in a manner similar to essential elements are more susceptible to rapid uptake and retention. So an example of this would be nuclear waste. It could be present as a potential health hazard. And then the fourth one is biomagnification, and that results when the accumulation of a pollutant greatly exceeds the rate at which the organism eliminates. So an example would be certain chemicals that are banned in the US each have their own degree of toxicity. And then synergism is simultaneous action of separate substances or agencies that together produce a greater total effect than the sum of their. So that's sort of like a toxic bundle, right? Just like we think of in healthcare. The bundle is only effective if we utilize all the components of the bundle, but actually when we're talking about toxic substances, when you have more of them together, cumulatively, it has a much worse effect. And then we talk about toxic substances Any chemical can be toxic. So, for example, table salt in a large quantity can be really toxic. What about chlorine? Chlorine in just the right amount helps purify drinking water, but in the wrong amount, it is a toxic substance. And there's 4 major categories that are toxic. It's pesticides, industrial chemicals, metals, and substances with radiation-emitting isotopes. And then again, we're back to these same things we see over and over and over again in this chapter. Primary, secondary, and tertiary prevention strategies. This pertains to environmental influences on health. For primary prevention for environmental factors, codes, conducts. So this is like we have factory workers. So we follow OSHA regulations for factory workers. That means they have to have ear protection. They have to wear goggles. If you're a business owner, you have to provide these certain things to all your employees. Under the secondary prevention, it would be, for example, like the occupational health nurse. And let me give you a really good example. So I did my population health clinical for my BSN at 3 Mile Island when it was still open. Okay, so I don't hear any cracks about how old I am, so we'll just keep moving. While I was there, I actually got to walk across in TMI with the occupational health nurse. She walked me all around. We walked across the concrete bridges over the uranium pools, which is the coolest thing ever. But she had a really serious job of monitoring radiation exposure with all the employees at TMI. It was actually a really, really cool experience. It was life-changing. And then under tertiary prevention is what if the rad counters encountered, we're using the same TMI example. What if the rad counters showed too high of levels for 1 month? So that occupational health nurse would have to monitor that, have to suspend the employee from working. There would have to be this whole chain of command and a protocol for what we do when exposures get too high. And that's it for me. I hope you have a great rest of your day. Thanks so much for listening.